Hello everyone. Now I will discuss about a most important things, that is how to interpret an ECG. I will show it by step. Okay, let's start it. So we know that ECG is a graphical representation of our heartbeat. Say it is a ECG paper. It is a normal in normally ECG have normally it takes 12 lead ECG, 6 are limb lead, lead 1, lead 2, lead 3, lead AVR, AVL, AVM, and sorry, B, and these are the chest lead B1, B2, B3, B4, B5, and B6. Okay, and we take an ECG of and another lead, that is the elongation phase of the lead 2, that is called long lead 2. Okay, so rather than that, another many leads are there to see the right sided things. We use as the right sided some chest lead. Those are some special case. So when we will get a ECG paper, we at first I tell that here every there is a large box. You can see that is a large box, and every large box have 25 small box. Horizontally it has 5 boxes, and vertically also there is 5 boxes. Okay, totally it is by 5 into 5 means 25 large square. Okay, and if we take a small square, it is 1 millimeter into 1 millimeter. Okay, and if we take and is this horizontal 1 millimeter means the duration, it means the duration of 0.04 second. Okay, so in 60 second, 0 point, so 0.04 second is means one small square. So 60 second means 60 into 1 by 0.04 small square means 1500 small square. Okay, means in 1 minute in normal heart, if we a normal ECG paper travels 1500 small squares. Okay, and horizontal, sorry, this, and this vertical duration, vertical, this vertical, this indicate the volt, and 10 small square equal to 1 millivolt. Okay, means this much duration is 1 millivolt. Okay, it is the, see that it here is a calibration. It indicate that normal it indicates the voltage, how much voltage it is taken by the ECG machine. Normally it is 10, so means 1 millivolt. See, it is 10 millimeter, so it is 1 millivolt. If the calibration is increased, means we we can see their voltage is taken. So contact voltage is less. So to observe the wave, imagine we had increases the amplitude of the waves by measuring. Okay, suppose it's a case of very obese patient. They are the amplitudes of the waves are this much, so we cannot understand and observe the waves properly, so it needs to be amplified. So how can we see that I can know that amplified there the calibration will be more. Okay, and where the amplitude of the waves are much more, suppose make much more ventricular hypertrophy is there, so that it cannot be adjusted in the ECG paper. We need to decrease the wave size so that it can be fitted in the paper, so it decreases the calibration size. And all we decreases the calibration size as well as the size of the waves. Okay, so that we can understand it is normal uh, voltage, or it is amplitude is increased or amplitude is decreased by seeing the calibration. Okay, now I will see tell that the waves of ECG. ECG starts with a P wave, then it comes the negative, that is Q, then R, then it is S, and then T wave, and in some cases it is the U wave. Okay, it is, so it is the P wave, it is Q, it is R, it is S, it is T, and it is U. Okay, this is starting from the P to starting from the R is the PR interval, and this is the ST segment. Okay, and it is the J point. Okay, now when we will get a ECG paper, we will read the ECGs, like we'll start from the calibration, then we'll see the rhythm, then rate, then axis, then spatial waves, and then we will look about every uh, leads. Okay, this is the sequence. If we see look at the rhythm, rhythm is two types. Rhythm is either regular, means beat is coming in regular manner in same interval, like in normal heart, or sinus, brady, or tachycardia, or it may be irregular. Irregular is also two types. So it may be regularly irregular, like second degree AV block, sinus arrhythmia, or it may be irregularly irregular, like atrial fibrillation or MAT. Okay, we see the rhythm at long lead 2. This is so that rather than 12 leads, we take the long lead 2. Okay, see here the it no wave has here does waves are coming in irregular manner. Okay, it's a significant of it is the long lead 2 and this lead, and we'll see the rhythm. It is lead waves are coming in irregular manner. It's a actually it's a ECG of atrial fibrillation. Okay, See, in this ECG, every beats are regular, but in the meantime, somehow this uh, this wave is coming and making it irregular. But this wave is also coming in a regular manner. It is regularly irregular. Okay, it's a ECG of supraventricular ectopic, and it's this ectopic made it an irregular. So it's a ECG of uh, regularly irregular. Okay, see, it is a ECG of regular heartbeat is coming. Okay, now we will calculate rate. Rate is also calculated in the long lead tube. In case of regular heartbeat, we know that ECG paper travels 1500 small square in a minute. So how much we will take the uh, duration from one P to another starting of another P, uh, and or one starting of one art to another art, because in this here everything is regular. So we'll take out calculate how much small square is there, and we'll divide this by 1500. Okay, and then we will get the rate. Suppose in this ECG here P wave is starting from here, and and P wave is starting from here. So duration of this wave is up to this much, and we'll take this much: one, two, three, four, 5 and 3, 8, 9, 10, 11. Okay, it is approx 11 small square. Sorry, we will divide 1500 by that small square, not this is. Denominator will be the. Okay, now we will by 11 equal to 136. Now we will tell how to calculate the irregular heartbeat. Here it is quite difficult because everything is not in symmetrical way. So we know that ECG travels 0.04 second in one small square. So we will take 6 seconds, the last square in 6 seconds. So 6 seconds means 6 by 0.04 equal to 150 small square equal to 30 large square. Once one large square equal to 5 small square, we know. So small square. So we'll take how much, we'll count how much R waves are there in 30 large square. Then we will multiply it with 10. Means 6 second is multiplied with 10. That is in uh, 60 second how much R wave will be, R wave are there will get, and that is the uh, rate of irregular heartbeat. Okay, See here in our wave, one here up to here. This is the 30 last card there. Among there, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 10 are is there. So we will know if we multiply it with 10. So 100 our wave means 100 heartbeats are in 1 minute. So the heart rate is 100. Okay, thank you.